want to congratulate Brazil again for putting equity so strong on the agenda and on the health agenda and on the climate agenda. So thank you very much. You have been continuing to do so. So first, I want to put a little bit of context. We live in a very unequal world. And in this world that's already so unequal with so many inequities, we have a crisis coming that will, like we saw with COVID, that will exacerbate, and it already exacerbates those inequities that exist. So this is a first point that I would like to make. The Americas, the region where we're in and where Brazil's in, is the most unequal region in the world. And so we cannot think about any policy, any strategies without looking really at populations in situation of vulnerability. And I think there has been an attempt in the climate change and health agenda to put equity there. But then what we do, we say vulnerable groups, women, children, elderly, disability. In the end, we have all the population, but we do not look at the conditions of vulnerability. It's not every child, it's not every woman, it's people living in situations like in slums, in the Amazon, in areas and that make them vulnerable without social protection, migrants, etc. So this is a focus that I think is going to be extremely important when we talk about adaptation and including about mitigation. So we're looking at the environmental impact that's happening and that's being exacerbated by climate, on human health. For example, rising temperatures. Rising temperatures is very uncomfortable for everyone. But it's much more comfortable for me in my house with air conditioning than for somebody who has to work on the street or who lives in a crowded space with, and it's totally, cannot adjust to the situation of rising heat. The same severe weather. When we talk about storms, when we talk about hurricanes, where does this has again affected people who live in the most in housing that's already inadequate, in areas where we shouldn't even have built in the first place. So again, I think it's important for each of those elements to drill deeper and to think who is really affected, why, what are the conditions, and what are those mechanisms that create those conditions, because that's where we have to intervene with our policies. The same with air pollution. Yes, air pollution is bad, but it is much worse for those who live around industries, for example, in cities. And that's not, again, this is not, this is design, we can design this differently. So I think this is the kind of the issues I want to bring. We talked earlier about biomass, people still cooking, indigenous populations that are cooking still with wood, etc. in their homes. I mean, we need to look at that. How do we transition? And we talk about fair and just transition and green transition. How do we take that into account? So, wash, obviously, water and sanitation. We see the water scarcity becoming a real issue, but there are people for which it means you cannot wash the car. And for other people, it means they don't have access to water for weeks. And there comes a tank every now and then. And that's, of course, where they have to save the water, where you get the dengue outbreaks because the mosquitoes can breed. So again, deep thinking. So I want to end here with some questions more than answers. So my question is, how do we make those inequities visible? Who are the people? And it's not just saying women, children, adolescents. It's not like that. Who are they? Where do they live? Why are they in these conditions? And if we don't understand the why, it will be very difficult to address them. And how do we ensure that our adaptation measures or our mitigation measures do not make that gap even bigger? That again, I think COVID is such a powerful example. As a crisis, what it did, it exacerbated, it amplified the pre-existing inequalities. Climate change is doing exactly the same. And we need, if we do not, from the very beginning in the design of our adaptation programs, etc., take them into account, we're going to miss the boat. And there's going to be a lot of people who are going to miss the boat. So with that, thank you very much.
Thank you, Jerry. We have a lot of provocations, right? We need to think a lot about. Bom, agora eu vou passar a palavra para o Tamer para dar suas contribuições, por gentileza.
Thank you very much. And I'd like to, first of all, just start off by saying that I'm extremely delighted to be with you here today, to join in this discussion, and my appreciation to the Ministry of Health from Brazil for having me on the panel. So I want to start off at the beginning by saying that when thinking about the challenges in relation to adaptation in developing country context, we need to be able to look at this from both a demand as well as supply perspective. And I want to say that the challenge is twofold. One, that climate change is actually impacting on the demand for healthcare services in low and middle income countries. And that the demand that we're seeing is actually not uniform across society. In fact, just as Jerry was saying, certain population groups will be more affected than others, and we need to be able to identify which population groups those are. She talked about women, children, the elderly. I want to add another category in there that we sometimes miss: migrants. And we need to be able to think about that because the climatic shocks that the world is seeing is actually displacing a lot of populations as a result of that. The second challenge that I see is in relation to how this demand that we're talking about is actually happening in already constrained health systems that are even not able to cope with the routine delivery of services. So this is not just about the fact that there's an increased demand, but the demand itself is coming in a different context. Fiscally constrained environments, polycrises, and competing priorities within the health sector. So to me, this is a situation where we're looking at low and middle income countries already struggling to meet the demands of their populations, irrespective of climate. Add alone climate on that, and you see further, obviously, aggravation of the challenge. And here, perhaps to say that when we come to think about these challenges, we need to be able to think about those challenges in the light of funding and financing that is going towards those health systems. So we all know that many countries, many health systems, they are already significantly underfinanced. Not just that they're underfinanced, in many cases they're inefficiently financed and inequitably financed as well. So to put this in perspective, what this means is that the burden is going to be falling onto individuals and households that are going to be bearing sort of the major brunt, if you will, of the fact that their systems are underfinanced. Meaning what? Meaning that you're going to have high out-of-pocket payments that will push a lot of people into extreme poverty as a result of that. And the climate crisis is coming in to further aggravate and exacerbate these inequities that we're referring to. Now, again, I think it's important to mention that when we think about financing for health, from a climate perspective, this is financing that is coming in from health into climate action, but it's also important to take into account that financing would be coming in from climate for health action, both ways. And if we were to think about the out-of-pocket payments and how countries are facing huge out-of-pocket payments to the extent where there are catastrophic expenditures on health, the vulnerable and the poor are the ones that are being hit the hardest. And in fact, they will be the ones that are then also pushed into extreme poverty. And I want to perhaps quickly just point to an assessment that we did at the World Bank, where we looked at the impacts of the climate crisis on poverty, extreme poverty by 2030. And what we're seeing out of this is that 132 million people would be pushed into extreme poverty by 2030 if we take no action today. Now, interestingly enough, out of this 132, a third, 44 million people, would be pushed into extreme poverty because of the health-related climate-driven impacts. So that's a huge number of people that we've pushed into extreme poverty. Now, I want to end on the note, okay, well, what do we do about it? How do we move from here? And I have two main points to bring into the discussion. The first point actually comes into focus on how we move towards transformative health systems and transformative resilience within health systems. And what I mean by that is that how do we enable health systems to prepare and manage the impacts of the climate crisis for their communities, while at the same time doing so with an eye on being environmentally conscious, reducing greenhouse gas emissions, and in doing so as well, ensuring that we're bringing in a cross-sectoral perspective in this, because this is not just about the health sector per se, but it's how the health sector plays a role with different sort of parts of the entire economy. Just like what Jerry was saying, we need to be able to take into account WASH. We need to be able to take into account the air pollution and environment, agriculture and agricultural productivity, so on and so forth. But I also want to emphasize that given that we're talking about equity, we need to take into account social protection. This is about ensuring that we have adaptive social protection that is able to provide for insurances for the poor and vulnerable that will be hit the hardest. And my second point is in terms of financing. And this is about really thinking about the sources of financing, thinking about the different instruments that we bring in the financing space. And by the way, this is not just limited to development banks or to the let's say, philanthropies, but equally so to the private sector. We need to be able to see the role of the private sector in financing and in service delivery. And that's why I'm really happy that we're joined by our colleagues from the International Finance Corporation of the World Bank, because of this focus on private capital. How do we bring in innovations and technologies to the forefront? We need to ensure that financing is predictable and sustainable. And we need to also ensure that we're mobilizing finance from both climate financiers as well as health financiers. And I want to end on the note that we need to ensure that financing is actually responsive at times of shocks. I'll stop here, and I think that with the second question, probably we're going to go into more of the details and give some of the examples from countries across the globe. Thank you.
Thank you very much. Bom, Tamer chamando bastante atenção, né, para a importância de um financiamento equitativo, né? E, bom, vou passar a palavra agora para a doutora Agnes, e depois eu parto para a segunda pergunta.
Okay. I think my colleagues here have shortened my presentation because they addressed I think the broader aspects of climate change and health equity. But I would like to draw attention to something. Climate change has a broad range of health effects. And we talk a lot about all of this, and I think we have been moving from looking at particular diseases, the impact of particular diseases, and working much more on the broader effects, because we cannot tell apart which one will be affected. So many are that can really burden the whole system and burden the health of the people. But we don't talk much about, or not sufficiently, to draw attention to what we call this, how do you address the structural racism and discrimination? Because we need to name that. Otherwise, we will not do enough work or sufficient work to change the situation. So we know already that the poorest in all countries, and the poorest countries or the developing countries have the highest impact. And this is not a matter of talking in general lines. 79% of the deaths are in the poorest countries or in developing countries. So this is not something that we can just forget about and talk in general lines. We need to address that. If we are the health sector, we are worried about people getting sick, and we are worried about people dying in a way that could be prevented. Everyone will die someday, but not all at once and not so directed, having a direct impact of something that could be preventable. And if we look at the situation, for instance, how it's already happening, and how much of the funds go to adaptation, but not adaptation in general, is to build resilience in the health sector and build resilience to the population. When we know this is what is causing the problems, when we know that we are not even measuring how much this impact could be prevented, and how much of the resources that I spent on solving the problem could be directed to doing something about it. So when, and this will, it's not about if, but it's about when major climate events will happen. And as a Brazilian, I talk with some experience already. As we have this year worked in both situations, with extreme drought periods and with extreme weather events that led to floods that almost most part of one state in Brazil was underwater. And what happened to healthcare facilities? Brazil, I think it's a privileged country when it means having universal health access. But when you have such a huge impact, what was already difficult to get to the ones that normally are forgotten, and the ones that are the people that are the most difficult to get in terms of coverage of healthcare and coverage of health promotion and on everything. They are the ones that are easily forgotten when you have to address the whole population. So we're not talking about something that is not visible. It's only that we don't put the right color of lens to look at them. And when I talk about racism and discrimination, it's exactly what we do when we have the means to count and have the means to do some surveillance and preparation, but we don't do anything about it, because when we look, the majority of the people live in cities, and we have to do a lot of work to make the cities resilient. But the cities is for everyone. Normally, the big disasters, and I mean when an extreme event happens, there is a disaster. But disaster normally happens in one part of the city, not in the whole city, although everyone suffers with that. And normally, it is exactly the ones that are the most difficult to reach as universal coverage and equity and integrality. That is how we work in the health system. These are the ones that we need to put up front, name them, look at them, and have a specific plan, and think on how to find financing resources that will make this something from the past. So it's an opportunity to deal with climate change, is to do the reparation we should have been doing before. The only thing that changes is the urgency to do it, because if we don't do it, then we'll be in the health sector, just counting the death and counting the diseases. And I can say that this will affect everyone at some point, but not in the same way. So, of course, we see the dengue happening in places where nobody expected before, but the ones dying of dengue is still and remains the people who are already suffering from all these difficulties in having access to services. So how do we do to improve the access, to improve coverage, and to bring them into this social protection, and at the same time decrease emissions as we're asked to do at the health sector? So we need to think that our priority is being this protection between what the world has provided, like the very little means to some, to the majority of the population, and a lot of means to the ones who don't need so much protection. So we need to make, to work in our policies in a way that we make them visible, but also that we make our policies directed, thinking on how to bring them at least at the same level as the rest of the population.
Muito obrigada, Agnes, evidenciando, né, como o nosso sistema de saúde tem que lidar com a questão do racismo climático, né? Eu vou partir para a segunda pergunta, voltando à questão do financiamento. Como pode a cooperação multissetorial e internacional ajudar os países em desenvolvimento a acessar o financiamento necessário para implementar políticas climáticas e de saúde mais equitativas? Jerry, por favor.
Obrigada. So this COP, we also call it the finance COP. So this discussion on finance has been everywhere, and I think it's very pertinent to have that discussion here too. But I'm going to pose a question. You know, finance for what? And so I'm talking from the World Health Organization, Pan American Health Organization perspective. What we have been doing is work with countries to make sure that they have plans, that they have included health in their national adaptation plans. How many countries still do not have any action from health? They're not even at the negotiation table. It took until last year until we had a health day in the COP. So I think Brazil is an absolute fantastic exception. But many countries still have the ministries of health are very timid. So within that, when we ask for funding, we need to know exactly for what. Last October, the countries from the Americas approved a new resolution on action on climate change and health, but equity-oriented action. You know, to put really that focus there. And there are a couple of things that are important here to mention. First, when we talk about adaptation. Are we really ready for, you know, the dengue? No, dengue in Patagonia, dengue in Mexico City, places where before we couldn't even think about, just with 1/2 degree, and it's there. So are we ready? Are we ready as ministries of health, as the health sector? I don't know. What do we want to fund? You know, this is a question that I will be coming back to. Are we ready for those new realities? Many of those health national adaptation plans also, and in the morning somebody mentioned are child blind, but I would say are also equity blind. So that is also something that we really need to start looking at. Mitigation. The panelist mentioned it's the health sector in a world where many people do not have access to health care, to quality health care. It's very easy to say, oh, we have to green up the sector, we have to invest in that, if we still have large parts of the population who cannot even go to the health facility, to primary health care, etc. So what is that balance? How do we balance that? And of course, when you talk about mitigation also, and I think really important to find those win-win situations where you are greening a city, where you are making a city more walkable, where you put public transportation so it will help the air pollution, but also the active transportation. But again, with an equity focus. You know, when I was working in Mexico City, you have those nice projects and ciclovías, and it's fantastic. But the poor from the slums, they will never be able to get there. And there are no bicycle roads, and plus too dangerous. So again, focus on the ones who are excluded. Then, of course, community participation. I want to really put a lot of emphasis on that. We cannot, the solutions are going to come from the ground, from the local level, from the people who live the problems. They know what they need, and they have to be with us at the table to find the solutions that need to come up. Local level, local governments, not only cities, no, local governments in general, I think is going to be extremely important. Of course, we need better data, but again, we shouldn't hide behind the data and we said, oh, we need more data before we can act. No, we can act now. We know more than enough for action and for equitable action. And lastly, in that policy that was adopted by all ministers of health in the Americas, we talk about funding. Yeah, but we talk about funding then based on plans, on concrete plans, and that's funding not only from outside. No, it's also redirecting, it's also redesigning, etc. inside. And I think the call also, the private sector has to play a role in this whole transition is very important. So I want to end saying, okay, let's, health national adaptation plans are really an entry point for seeking finance, for being ready for the negotiation and the discussion. But again, let's not forget and let's ensure that the benefits do go to those who are left behind. That's my plea. Thank you.
Okay, so I believe Jerry is asking all the right questions and she's provoking us to really think about those questions. I want to start off at the beginning before talking about the financing, just to say that there's a picture in my mind that will remain with me for the rest of my life, and I will never forgive myself if I get to see that picture happening as we further progress. And this is from Colombia, northern Colombia, La Guajira. And interesting enough, as a medical doctor, I was practicing in Egypt some 20 plus years ago. And I can say that while being in Egypt, I saw probably 2 cases of marasmus. In 1 week in La Guajira, in Colombia, I saw at least 20, 30 cases of marasmus, severe, acute malnutrition in children, resulting from droughts. The question is, well, why are we not doing anything about it? So it comes back to the question that Jerry was putting. I mean, financing for what? What is it that's going to give you that impact that you need to see? How do we ensure that we're able to address the climate-driven burden of disease, both from a morbidity as well as a mortality perspective, is going to be important. So therefore, a big part of what we're doing with partners, including with WHO, is thinking about what would constitute the most effective and cost-effective interventions that we can scale, looking at it from a cost-effectiveness perspective, looking at it from a benefit of cost perspective, but at the same time, looking at the feasibility of those interventions. And for the lack of a better word for now, we're referring to them as the best buys for climate and health. What is it that we can tell our countries, our partners in those countries, that these potentially may be the areas of investments that you can scale up? And how do we ensure that we're prioritizing that is going to have to be informed by what is happening on the ground, by understanding the context, by targeting the populations that actually need to receive those interventions. Now, coming back to the question, there are 2 parts to the question. The first part is on the multisectoral, and how do we work multisectorally to be able to deal really with the climate and health crisis. And the second part is on the international cooperation. So let me just focus at the beginning on the multisectoral element. when it comes to multi-sectorality, this is absolutely critical. And the reason I'm saying it's absolutely critical is because for us to be able to impact on people's lives, livelihoods, this has to be all of government intervention, all of society intervention, working across sectors and cutting these boundaries. In fact, I'm very happy to see that Brazil is also taking on board the One Health approach. And how is it that we're working across sectors to be able to really bring it out the results that are intended from this. So I want to say that for us at the World Bank, this is fundamental. This is about working with different line ministries, bringing in ministries of finance also into the equation. It's not just the discussions that we're having with the Ministry of Health, trying to sort of bridge also the discourse between line ministries like energy, environment, water, so on and so forth, so that we can bring all of them into how we think about really working as a whole of government and whole of society approach. At the same time, as I mentioned, previously, this is about the private sector. So it is extremely important as we go into the discussion about the multi-sectorality, also understanding that we need to be able to break the silos between public and private. We need to be able to understand that the private sector is a major player when it comes to healthcare service delivery, when it comes to medtech. We need to ensure that the private sector is at the table. And therefore, the work that we're doing, again, with our sister organization, the International Finance Corporation in this case, is really trying to get us to understand the landscape of how we integrate and how we bring the private sector to the table. And I want to be able to say that beyond that, this is also about ensuring that we bring in guarantees to the private sector. So the role of the Multilateral Investment Guarantee Agency, MIGA, which is another sister organization of the World Bank, in this respect is extremely important. How do we ensure that we're providing for the de-risking mechanisms around the kind of investments and the scale-ups at a country level is going to be important. So that's on the first part. The second part, on the international cooperation, I want to be able to highlight a few sort of examples of how we've been thinking about this. The first one I want to start off with in terms of providing for more access to finance is what we've been able to do in establishing a development bank's working group for climate and health finance. And this was in the lead up to COP28. Now, we came up with a roadmap, a common investment framework. We focused on opportunities for synergistic financing, and we've defined how we're going to operate together. And in fact, one excellent example to bring in here is what we did in Indonesia. In Indonesia, 4 development banks came together to co-finance an operation that is coming in to strengthen primary healthcare, strengthen hospital, strengthen laboratories, and scale up climate finance, a $4 billion investment. It was the World Bank, the Asian Development Bank, the Asian Infrastructure Investment Bank, and the Islamic Development Bank. So that shows how together we could come up and really scale up financing and action. I also want to perhaps highlight, since we're in the Brazil pavilion, that we have public development banks as part of this working group. And in fact, we're very honored and privileged to have the Brazilian Public National Development Bank, BNDES, as part of this working group. Now, the reason we're bringing in the public development banks and the focus on the Financing Common Coalition is because we recognize that the public development banks are by far the biggest players. Public development banks are investing nearly $2.3 trillion annually on overall investments across all sectors. In fact, that constitutes about 10% of the annual global investments. So if we were to just cut a small share of what public development banks are putting in this space, that is huge for what we're trying to do in terms of access to finance. Now, shifting gears, this is a country agenda. It's about country ownership. It's about ensuring that countries and governments are in the driver's seat. So adopting what is known as a sector-wide approach is a way of thinking about how we can bring finance closer to governments so that they can access that. The example here that I would like to use is from Nigeria. Nigeria has come up with a sector-wide approach focusing on improving quality of services, increasing utilization, and also streamlining climate resilience within that. And because they were in the driver's seat in how they've designed the operation, they've been able to attract not just the World Bank, but also resources from the Global Financing Facility. The World Bank came in with $500 million in this operation, but others are coming into this space. The Children Investment Fund, in addition to us. So I want to end on the note that the equation here is about thinking about financing from so many different elements. The role of climate financiers, health financiers in this space. And it's not just about the development banks. We also need to be talking about domestic resource mobilization and how do we prioritize action within domestic budgets. Very final point, the World Bank has committed itself to reaching 1.5 billion people by 2030 with quality, affordable health services. Now, for us to succeed in reaching that goal, this has to be about people, this has to be about addressing vulnerabilities, and this has to be about addressing inequities. Thank you.
Well, I have 5 minutes to close this session. I'll just bring some of, I think the most important things maybe financing has been said, but I would go back to the people who do not have a voice and cannot sit at the table to discuss these things, not with the way things are now organized. So we call it social participation, but in fact, for us in Brazil, it's part of the system, so it's always a negotiation between the users or the population organized in movements and the system itself at federal, state, and municipality level. I know it's not everywhere, and I know for some people, affordable is a good word. For us, it's universal health care is a human right, and it's in the Constitution, and we want to be like this, and we'll fight for that, and it's in our heart that this is the way to go. So equity is built within the system, and what we need to know is how we make it happen, and quick, because when I see that indigenous population have 16 times more chance of dying of diarrhea than the general population, I don't think I can see that as a medical doctor, as a person. I cannot see that in sleep thinking I have done a good job. So I think the world must look at these numbers, thinking of all the people behind them. So when we talk about financing, and I said grants or repairing the damage, this is something that we cannot postpone. And this is our duty to make sure that these people will be counted and will be protected and listened. And the solutions will come from this conversation. And I think this is when we talk about what would be a good way for thinking on solutions and for financing, we need to go deeper into the discussions. Otherwise, we will not solve the problem, and we will be very happy with all the diagnostics we'll do about the situation, but we will hardly be changing the reality. And I think if anyone had any doubts of the kind of damage that can happen, and that suddenly the whole population is at risk or at higher risk, I would say, then I think if you have not lived, you're lucky, but most of us have already seen this very close. And anyone working in public health, I believe, has seen this too close and too deep, and has spent at least many nights without sleeping to try to avoid the higher damage. So talking about financing is not talking about something very far away. It has to be brought to this ground level discussions. And I think if we discuss this and we don't discuss equity, and if we don't think about indigenous communities, quilombolas, traditional communities, there is nobody here talking for them. And we need to have them sitting on the table and talking on their own terms and their own voices. And before this can happen, I think we are the ones who need to bring this issue to the table. So thank you very much for this, for being here. And I think we'll have a very big challenge ahead of us.
Jerry, Temer, Agnes, thank you very much. Obrigada por aceitarem o nosso convite para esse painel. Eu agradeço a presença de todos vocês, né, e gostaria de reforçar aqui o nosso compromisso do Ministério da Saúde em trabalhar incessantemente, né, para buscar esse atendimento mais equitativo para as populações vulnerabilizadas, né, para que a gente vem desenvolvendo um plano setorial de adaptação às mudanças do clima e contar com todos esses parceiros, né? Precisamos do apoio do setor privado, dos bancos, organismos, né, para que a gente consiga aí vencer esse grande desafio. Muito obrigada a todos vocês. Boa tarde.